All right, today we're tackling a big topic. What happens when you've done everything right with diet and exercise, but it's just not enough? We're going to dive deep into the science behind prescription weight loss meds and look at the powerful tools that modern medicine has to offer. I mean, it's a super frustrating spot to be in, right? You're eating clean, you're hitting the gym, but the scale just isn't moving. It can make you feel like you've hit a wall. So when you've done everything by the book, what's next? Where do you go from there?
Well, the answer, more and more, is found by looking inside, at our own biology. You see, modern medicine is getting really smart about working with our body's own complex systems, not against them. It's all about using targeted approaches to gently nudge our metabolic pathways in the right direction.
Okay, so let's break this down. It's really important to get this. Not all of these medications do the same thing. They actually have totally different angles of attack. Some go after the brain, others work in the gut, and some focus directly on your metabolism.
First up, let's talk about appetite suppressants. The easiest way to think about these is like they're a special messenger to your brain. They basically deliver a note that says, hey, we're good, we're full now. And that little message can make a huge difference in cutting down the urge to keep eating.
So how does that actually work? Well, by zeroing in on those specific appetite centers in the brain, you start to feel full a lot sooner than you normally would. And that, of course, means you're likely to eat less overall. But, and this is a big but, because we're talking about influencing brain chemistry, you absolutely have to be monitored by a doctor. That's totally non-negotiable for safety and to make sure it's actually working for you.
All right, next on the list is a totally different strategy. These are called lipase inhibitors, and they don't talk to your brain at all. Nope. Instead, they work like a gatekeeper, right there in your digestive system, physically stopping some of the fat from the food you eat from ever being absorbed into your body.
So, how does this gatekeeper do its job? It's pretty clever, actually. It blocks a specific enzyme. It's called lipase, and that's the one your body needs to break down and digest fat. A common one you might have heard of is called orlistat. Now, because of this mechanism, doctors almost always pair it with a low-fat diet. That really helps manage any digestive side effects that might pop up. Okay, our third category, thermogenic agents. The idea here is actually pretty simple to grasp. It's kind of like turning up the thermostat on your body's internal furnace. These compounds give your metabolic rate a little boost, which means you end up burning more calories, even when you're just sitting around. And you'll probably recognize some of these ingredients. We're talking about things like caffeine and green tea extract. Now, the effect isn't usually dramatic. It's more on the modest side, but it's definitely measurable and can be a piece of a bigger puzzle. The catch, because they can rev things up, including your heart rate, this is another one where you absolutely need a doctor's supervision. It's just essential. Okay, so what happens when one approach just isn't enough? What if you need a more comprehensive strategy? Well, that's exactly where combination medications come into play. These are really smart formulations designed to tackle weight management from several different angles, all at once. And this is where things get really interesting. You can have a single pill that combines multiple mechanisms. Imagine something that reduces your appetite and boosts your metabolism and maybe even limits a bit of fat absorption all at the same time. It's a true multi-pronged attack, perfect for those more complex situations where just one method isn't getting the job done. Now, this next category is really fascinating. They're called SGLT2 inhibitors. And what's wild is that they were first developed for type 2 diabetes, but then doctors noticed a very helpful side effect for weight loss. Basically, they work in your kidneys and prevent your body from reabsorbing sugar. So instead of that sugar going back into your system, you just excrete it, along with all its calories. And that leads to this incredible dual benefit. Not only do patients see gradual weight loss from getting rid of those extra sugar calories, but these drugs also have proven positive effects for your heart. That makes them a really compelling choice for anyone who's dealing with both weight and cardiovascular concerns. Okay, so we've covered the how these things work. Now let's put some real names to the science. This is where we connect all these mechanisms to the actual FDA-approved drugs that doctors are prescribing today. So let's take a look at this chart to connect the dots. You've got Contrave and Qsymia. Those are the combination drugs we were just talking about. Then you have orlistat, that's our lipase inhibitor, the fat blocker. And then you have Saxenda and Wegovy. These are huge right now. They're both powerful appetite suppressants in a class called GLP-1 agonists. And yeah, these are the ones you've probably been hearing about all over the news. They work by mimicking a gut hormone that tells your brain you're full. And that's why they can be such a game changer for so many people. But, medications are only one part of the picture. They're one set of tools in the medical toolkit.
As we look at the whole spectrum of care, especially for people with more severe obesity, the conversation can shift toward much bigger, more structural interventions.
And the difference in approach here is really night and day. Medications are a biochemical fix. They're all about working with your body's internal chemistry. Bariatric surgery, on the other hand, is a structural fix. It's a major surgical procedure that physically changes your digestive system.
Now, the results from surgery can be, wow, truly life-changing. We're talking about significant, long-lasting weight loss. It can often improve or even resolve other health problems, like type 2 diabetes or sleep apnea. But, and this is so important, it is not a quick fix. It's a very serious operation, it's only for patients who meet specific clinical criteria, and it requires 100% commitment to a new lifestyle. Forever. So, we've walked through all these different options, right? From different kinds of medications all the way to major surgery. So what's the one big, most important takeaway from all of this?
It really comes down to this. There's no magic pill. There's no one-size-fits-all solution. Every single one of these treatments, whether it's a medication or a surgery, has to be personalized. The right choice for you depends completely on your unique health situation, what your goals are, and what other conditions you might have. And it must be supervised by a doctor. That part is not up for debate.
So the ideal journey for any patient always follows these steps. First, a complete medical evaluation to see the whole picture. Second, a personalized plan is created based on that evaluation, choosing the right tool for your specific needs. And third, and this is so critical, is ongoing supervision from your doctor to make sure everything is safe and effective. That's the framework. That's how this is done right. And all of this really leaves us with a big question to think about for the future. I mean, we've come so far in our ability to work with our own biology instead of just fighting against it. So as our scientific understanding gets even deeper, you have to wonder, how are these new, smarter tools going to continue to reshape our entire idea of what health and wellness even mean?